All right, good afternoon, everyone. Thank you for joining us today for this Grand Rounds presentation on therapeutic gardening, food growing for chronic disease prevention, and financial resilience in communities and correctional systems. It is my pleasure to introduce today's speakers. We have Justin Harris and Afam Maduka with us today. Justin Harris is a medical student at Southern Illinois University School of Medicine, pursuing a career in neurology, co-founder of the SIU Lifestyle Medicine Interest Group, and co-host of the Southern Illinois podcast. His interests include lifestyle medicine, environmental health, and how food growing interventions improve chronic disease outcomes and community health. Afam Maduka is a medical student at Southern Illinois University School of Medicine who works with the Office of Correctional Medicine on the Health Matters Initiative, creating educational health content for incarcerated individuals. And he is passionate about mentorship, community building, and using nutrition and procedural interventions to improve musculoskeletal and chronic disease outcomes while advancing health equity in underserved populations. So without further ado, here's our speakers.
Good afternoon, everybody. It's a little bit of an incline. Thank you all for being here today to see this presentation. We're going to be discussing therapeutic gardening, food growing for chronic diseases and prevention. We'll talk about financial resilience, how that relates to local communities, and how this can be implemented within correctional systems. We're going to try to make this as interactive as possible, so feel free to participate when we ask questions. My name is Justin.
And my name is Afam.
Oh, my bad. So here are some of the objectives for today. So we're going to discuss the evidence-based health benefits of community gardening. We're going to also evaluate successful models of urban gardening and prison gardening programs, as well as we're going to demonstrate some actionable strategies that you all can implement in the local community, clinical practice, or just in whatever institutions you all represent.
So we're going to start first with a case titled Tale of Two Patients. Again, like you said, this is interactive, but no wrong answers. Just kind of want to get everyone talking. So first patient, his name is Josh. He's a construction worker, 35 years old, works 50 hours a week, high physical demand for his job, walking, running, works on concrete. He lives in a federally designated food desert. If you guys don't know what that means, we're going to discuss it later on. Has access to fast food, but limited service convenience stores. In terms of physical activities, primary resource is a local municipal outdoor gym, but accessibility is subject to weather conditions and then just safety. So if he wants to get fresh produce, he has to travel out of his area, and it takes a significant amount of time. Uses carpool and public transport for commutes, and then his diet. He eats whatever is available. Doesn't really pay much attention to his diet.
Okay, and then our next patient in the case is Drake. He's a 35-year-old investment banker. He works over 60 hours a week at a desk job. It's a high-stress job. He lives in an affluent suburb. He's got access to high-end grocery stores nearby. He's got a home gym with local fitness clubs within 2 miles of where he lives. He also has significant time restraints, again, due to his professional obligations. He's mentally fatigued by the end of his shift. He has a personal vehicle for transportation. He does have a dietitian. However, due to the demand of his job, he's inconsistent at times. And often he will eat out with clients as part of his job.
So we've presented both patients. We kind of want to hear what you guys think in terms of barriers or any social determinants of health that come up in these two cases. So anybody want to take a stab? There's no wrong answers. I'll call out someone who's not looking at me. Oh, we have a hand? Okay.
So for Josh, because he does live in like a food desert, he has to do a lot of traveling if he wants to get better groceries and so on. So maybe that's one.
Mm-hmm. Okay. No, that's good. Yeah. Distance. Can we get one more? Yeah. No, definitely. Oh, sorry.
Yeah.
Yes. Yeah, so the first thing that Yusuf, okay, let me know when. Should I repeat it now?
He's
Oh,
gonna, he's gonna
they're
say,
gonna let him do it. Okay.
Hello? Oh, yeah. So I was saying for Josh, because they live in like a food desert, it'd just be they'd have to do a lot of traveling to get good groceries and so on. So that's just one thing that might hinder them.
Yeah, and I was saying for Josh, there's a lack of access to like a physical gym, not as close, and then you have Drake having like full access to the home gym and then a private fitness club. So there's going to be discrepancy in like their level of activity, which also affects health.
Yeah, definitely. So those are both good.
Mhm.
Gonna move along.
So both of these patients decided that they wanted to establish care with a primary care physician. They both have pretty identical presentations. They're both 35 years old. They've not been to a doctor in 5 years. They take no daily medications, no past medical history, no significant family medical history. While their physical exam was unremarkable, some of their vitals suggest they're obese. They have obesity, hypertension, and some labs are suggesting that they're pre-diabetic. So the physician, upon gathering this information, would like to start them on medications. However, they both request an alternative option. The physician agrees to allow them to follow up within 4 months, during which time they can make some lifestyle changes to try to avoid starting medication. And both of them are highly motivated to avoid medication. So just kind of recapping the points again, Josh, he's the construction worker. He lives in a high crime, a low income food desert. He works over 50 hours a week. He has access to an outdoor gym. And then Drake is the investment banker. He lives in an affluent suburb. He works over 60 hours a week at a desk job. He has a home gym and access to high-end grocery stores.
All right, so this would be the 4-month follow-up. Here we have some labs vitals, and we want you guys to guess which one is which. So again, Josh was the construction worker, and Drake was the financial or the banker, investment banker. So anyone want to take a stab?
No wrong answer.
Yeah, no, you're looking at, what do you think? No, you, yeah. Uh-huh. No, above. I don't know names. Gentleman in the jacket, looking right at me. You said what? You know? Oh, okay. Let's pick someone else. Eric, what do you think? Oh, sorry, she's bringing the microphone down.
I mean, I'm gonna guess maybe the construction worker is the one on the left.
Okay. And why do you think that?
Just if there's no change in exercise, he's still getting movement throughout the day
Because of his job.
because of his job.
Yeah.
So if he can change his diet, I think he'll have a greater weight loss.
Okay. That's good. Does anybody think different? So everyone agrees. Oh, wow. That's crazy. All right. Well, kind of stole the thunder. I'm just joking, but so you're correct. Josh is on the left. And the reasoning is different, but that was good reasoning. So despite the odds, Josh had a superior reduction in hemoglobin A1C, BMI, and blood pressure. So while Drake had the means, Josh had the method. He found a local community garden, which is related to diet, like you stated. So when we're looking at both patients, we titled this slide the pivot: community integration versus isolated affluence. Josh would be more the community integration, and Drake would be the isolated affluence. So we first look at consistency. So Drake had decision fatigue. He had access to all the high-end grocery stores, fresh produce, a home gym, and then private gym clubs, surrounding him. But he struggled being consistent. He struggled with sticking to a workout plan or regimen. In addition, the added stress of his work, he's working 60 hours or more a week, caused him to make more, the convenient decision at times. So that would be eating out more, skipping workouts. His health became an additional task that he had to add on to his already busy schedule. And then we look at Josh. He approached his health strategically. 2 blocks away from his home, he found a local community garden. He started going to volunteer 2 to 3 hours a week, primarily on the weekends. And he also started getting all of his produce from the garden. He did commit to using his outdoor gym once a week, but just overall, he was able to stay more consistent for those 4 months. Next, we look at exercise versus NEAT. So Drake, he participated in isolated HIIT training or high intensity interval training. So these were inconsistent sessions, high intensity bursts in his home gym. And if you do a lot of high intensity interval training, don't get proper rest, and you're doing it back to back, it can actually increase your cortisol. And it wasn't really sustainable. Josh, on the other hand, functional gardening. So he sustained NEAT, which stands for non-exercise activity thermogenesis. So I was bending, lifting, walking in a green space. It acted as like a natural sympathetic nervous system buffer. And then third, which is arguably the most important, mindset shift for habit change. So Drake, he treated his health as another task rather than trying to integrate it into his schedule and busy life. Diets and workouts just became somewhat of a burden by the end. And then on the other hand, Josh became a gardener. His health wasn't a medical goal. It was more of a byproduct of his new role in the community as a community gardener.
Mhm. So now I just want to give you all some brief historical context for community gardening. We'll start in 18th century England during the Industrial Revolution. You've got big industry bringing large manufacturing companies into the cities. You've got higher populations of people moving into the cities for job opportunities. But with these new increased populations, you run into problems like food scarcities. So cities are starting to set aside space for people with food scarcities to start gardening within the city. We fast forward a bit to the 1890s in the US, the Depression of 1893. The Detroit mayor at the time, he pioneered a program that was encouraging vacant landowners to allow for unemployed residents to farm on the vacant land and grow food there. And this kind of model spread around the Midwest to Chicago and to the East Coast and Boston, Buffalo, and Providence. And now we go to the 1970s, we have deindustrialization. A lot of manufacturing plants and industries are closing down. They're moving out of the cities. And then you have grocers, small businesses, which are now moving into the suburbs. And with them, it's referred to as capital flight. It was leaving a lot of vacant land and a lot of food deserts in low-income areas. So then in the 1970 to 1990, now you've got an influx of more people of color, more migrants coming into the cities. This post-World War II, post-Vietnam War. And you've got people settling in the cities, and they're now using that land to repurpose it for gardening.
Yeah, listen. All right. So food deserts was a topic of discussion that came up. Does anybody know what food deserts are, or do want to take a stab at trying to define it? Again, no wrong answers. All right. This one was okay.
Places where there is a lack of grocery stores or fresh fruits and available to the residents who live there.
Mhm.
Yeah, I can share. Yep. Places that have a lack of food, grocery stores, as well as fresh fruits and vegetables for the residents who live there.
Yeah, yeah. So that's pretty close and pretty spot on. The only other addition is distance plays a role. So it's defined as a low-income census tract with at least 500 people or 33% of the population living more than 1 mile from the nearest supermarket or large grocery store in urban areas, or more than 10 miles in rural areas. So there's that differentiation in when you look at urban versus rural. And another thing we want to talk about is food deserts doesn't mean that there's no food present. There's just no like fresh produce or healthy food nearby. So yeah, and another thing we want to talk about is food deserts are by design. They're not by accident. And a lot of times when we think of food deserts, we should think of the zip codes or the areas that they're in. Zip codes are a great indicator of your health outcomes, whether good or bad. So we should think about those two when we're thinking about food deserts and zip codes. And here's a map of food deserts in the United States. Currently, roughly 20 million people in this country live in food deserts. So that's 6% of the population. And this kind of just highlights, the red shows all the food deserts in the United States. And something people always point out is, you said it was Alaska.
Alaska, yeah.
Yeah, if you look at Alaska, most of it is red. So something to just check out. We have another visual of Illinois. All the green represents the food deserts. The description on the side is just another, or is the definition of food deserts again. And you can see Springfield in the middle. Just again, another visual aid so that you guys can see it. And then we wanted to finish with a study. So this was a study done in 2001 in Detroit, Michigan, and it's looking at number of food stores per type or per 100,000 by type. And this chart in particular compares low-income African-American communities compared to racially mixed middle-income communities. And what they found is, first, when we look at chain stores, so those would be like your Aldis, your Walmarts, your Hy-Vees, your Schnucks, when you compare the two, there's zero chain stores in the low-income African-American communities in comparison to the racially mixed suburban communities. As well, too, when we look at liquor stores, there are there's 4 times more liquor stores in the low-income African-American communities in comparison to the racially mixed middle-income communities. So this is just one study, and it was done in Michigan, but this just kind of shows, again, the relationship between zip code and food deserts. And I mean, you see here, it's pretty clear when we look at the two communities.
So if you were to do a Google search of gardening and lifespan, you'd see headlines like these. These headlines say that gardening could extend your life. It could be the hobby that could allow you to live to be 100. A lot of these headlines are based on the blue zones. The blue zones are regions across the world that have the highest concentration of people that live to be 100. And what they found when they've analyzed these blue zones is that the people that live there participate in very particular, similar, they have similar lifestyle habits as far as like eating plant predominant foods and having social connection and have a sense of meaning or purpose in life. So a lot of these values that we see or a lot of these habits that we see in people that live in the blue zones are consistent or in alignment with lifestyle medicine. So lifestyle medicine is a practice of medicine focusing on using lifestyle intervention to treat chronic diseases. It's based on 6 pillars of health, which I have here: healthy eating, physical activity, stress management, social connection, sleep, and the avoidance of risky substances. So today, like, our purpose is really to show you how gardening can touch on not just healthy eating, but on all of these pillars. So we will start with healthy eating. As Afam just mentioned, food deserts are a barrier to fresh produce. So we'll look at how gardening can kind of combat that barrier. So in the image I have here, this is various images of the Philadelphia Urban Gardening Project, which is a project that was trying to assess and improve urban agriculture in the city of Philadelphia in like the 80s and 90s. Some studies came out of this project, one which came out in the 90s that was comparing the eating habits of gardeners versus non-gardeners. What they found based on survey data was that gardeners were eating 6 of the 14 fruit and vegetable groups that they included on the questionnaire more frequently than non-gardeners. So this data is consistent across some other studies as well. This study was an online survey testing, comparing gardeners versus non-gardeners eating habits as far as frequency of fruit and vegetable consumption. And what they found, again, is that gardeners eat fruits and vegetables more frequently than non-gardeners. And the other study that I have over here at the top right, this study was done in Flint, Michigan, where they were not even looking at people who were involved in gardening necessarily, but who just lived in a household where at least one person in the household participated in gardening. And what they found was that in the community gardening households, the people that lived there were 1.5 times more likely, they were consuming fruits and vegetables 1.5 times more frequently, and they were 3.5 times more likely to eat fruits and vegetables 5 times a day. So it seems to me a lot of research suggesting that gardeners are eating fruits and vegetables more often, but does this benefit, how does this affect health outcomes? So in the study here, they were trying to measure the dietary inflammatory scores of gardeners versus non-gardeners. They want to see how inflammatory their diets were. Basically, how they do this is they take the main component of a food group and then they measure how likely is it to increase your inflammatory markers. This could be things like C-reactive proteins and interleukins and cytokines, for example. What they found was that gardeners had a 0.77 score lower than non-gardeners. Now, what that means is with each 1 point decrease is associated with an 8% decrease in cardiovascular disease and mortality based on these studies. So this just suggests that, going back to the case, somebody who has increased food access is increasing their health outcome by also eating more fruits and vegetables as well.
All right, so next we're going to discuss physical activity in relationship to community gardening. So there was a term that came up, NEAT. Does anybody remember what it stands for? Want to take a stab at it? No wrong answer. Yes, yeah, non-exercise activity thermogenesis. Yeah. Yeah, so that's what it is. So we kind of wanted to, we want to just define that for you even more. So obviously non-exercise activity thermogenesis is energy expended in all physical activities that are not sleeping, eating, or structured or sports-like exercise. So gardening would fall under that. In an article titled Why Gardening is Great Exercise for Both Body and Mind, the RHS highlights that we need to stop viewing gardening as just a hobby and start seeing it as a legitimate form of exercise. According to Harvard medical data, just 30 minutes of gardening burns up to 189 calories. To give you context, that's on par with things like yoga, cycling, or other forms of calisthenics. And in that article from the RHS earlier, Why Gardening is great exercise for both body and mind. Dr. Lauriane Chamain-Puy, she's a former RHS Wellbeing Fellow and lead author of the research. And she essentially says the same thing. So she's been looking at this for years and says that, gardening every day has the same benefit as rigorous exercise, cycling or running. So when we think about the case, what does this mean? So Josh, who again was our construction worker and doing the community gardening, it acted as a form of functional calisthenics. While Drake was likely doing repetitive linear exercises, working out one body part at a time when he went to the gym, Josh is getting, the full panel. He's getting strength, conditioning, aerobics. And the real clinical advantage is it can be seen as effortless exercise because Josh is focused on his life in the garden rather than like the pain of a workout or having to plan a workout. His perceived exertion is lower. So he achieves the same physiological benefits as like a vigorous runner, but psychologically, he doesn't feel like he's working out because he's just gardening. Next, we have, this is an article titled Gardening and Yard Work Exercise with a Purpose. And it discusses METs or metabolic equivalents. Does anybody know what those are or want to take a stab at it? I guess not. So MET stands for metabolic equivalent. And it's a measure that exercise researchers use. And it's based on how much oxygen per minute the average person burns or uses during any particular activity. There's a lot of numbers, but the range we want to focus on is 3.0 to 5.9. And that falls into moderate intensity exercise. According to the CDC, We should be getting 150 minutes of moderate intensity aerobic activity each week. And if we look at this 3.0 to 5.9 and look at the chart right next to it, those are all gardening activities and they fall within that range. So this further shows that by gardening, you're meeting your weekly requirements or suggested requirements. And if we think back to the case, Josh was getting 2 to 3 hours of work in the garden each week. So that falls within that 150 minutes.
Okay, so next we want to discuss sleep. The recommended amount of sleep one should get each night is about 7 hours. Does anybody want to take a guess at what percent of the population gets less than 7 hours of sleep each night? Somebody said 50,
50%.
60? Those are good guesses. I imagine that this survey data or wherever this comes from is underreported. What we found is somewhere between 30 and 40%, but it wouldn't be outside of the realm of actuality that it's much higher than that. So we know that difficulty sleeping is associated with a lot of chronic conditions. We're talking about ischemic cardiovascular diseases, metabolic diseases, neurodegenerative diseases, and even mortality. So sleep is very important to health. And so, we just discussed physical activity. There are studies that suggest that physical activity actually improves sleep quality and sleep quantity. So we're going to look at some of that as it relates to gardening. So gardening, there's a study here that took 62,000 adults. They wanted to compare gardeners and people who did no form of exercise whatsoever. And they wanted to see how many of these two groups, like what percent of these two groups had multiple sleep complaints. So a sleep complaint could be anything like daytime sleepiness, insomnia, sleep apnea, or just short sleep at night. And it says multiple because they needed to have 2 or more of these complaints, okay? So what the data says is when they looked at the gardeners, 25% of them had multiple sleep complaints versus 38% of non-exercisers who had multiple sleep complaints, suggesting that gardeners were 42% less likely to have multiple sleep complaints compared to non-exercisers. So we discussed physical activity as being part of the gardening component that allows for people to get better sleep. But that's not the only component. The other component is green space exposures. So green space is any space that's mostly covered in greenery. We're talking about trees and plants and flowers, et cetera. So this review article looked at 13 different studies, and 11 of those 13 suggest that people who spent time outside in green spaces had a higher quantity and quality of sleeping. One study in particular, it measured people with sleep complaints, took them outside in the forest and had them walk for 2 hours, and then measured various parameters of their sleep. What they found was there were improvements in overall time in sleep, so they slept longer, decreased sleep latency. Sleep latency is just the time it takes to go from wakefulness to falling asleep. Things like that is usually increased in insomnia and other sleep disorders. They had greater time immobile during sleep. So when you're immobile, it's your REM sleep. It suggests you have more higher quality and deep sleep. And then the perceived self-reported, how they self-reported their quality of sleep was much higher in these groups of people after they had walked for 2 hours.
So we have one more study, and it looks more at the soil, and it's titled "Identification of an Immune-Responsive Mesolimbocortical Serotonergic System." I know that was a mouthful, but in this study, what they did is they investigated how soil bacterium, specifically Mycobacterium vaccae, affects the brain. And this study was done in 2007 in England. And so what researchers found is when exposed to this specific microbe, that being the Mycobacterium vaccae, it kicks off a specific immune response that tells the brain to start pumping out more serotonin. And serotonin is actually a building block or precursor to melatonin. So melatonin is really important. It drives sleep. restorative sleep, and is referred to as a biological sleep aid. So what this paper showed us is that by gardening, you're actually essentially inhaling biological sleep indirectly by the way of serotonin and then eventually melatonin. The next thing we're going to talk about, or the next pillar, is stress. So in this case, stress was a big topic of discussion in both patients, but specifically Drake. He worked a demanding job, 60 hours a week, ate out quite frequently, and likely wasn't getting enough sleep. Participated in HIT, which we talked about how that can spike your cortisol levels. And in the context of Josh, when we look at community gardening, the obvious benefits are clear: fresh food, physical activity, but what's happening biochemically is even more powerful. So plants emit this volatile compound called phytoncides, and phytoncides are essentially a plant's immune system. It protects it against rot and harmful insects, and they release it into the air as mist. So there was a study done in Japan titled "Effect of Phytoncide from Trees on Human Natural Killer Cell Function." And what they did in this study was they had 12 healthy males. They placed them in a controlled urban hotel environment for 3 nights. They took or they vaporized cypress stem oil. Those are the trees in the back, a rich source of phytoncides, into the room while the subject slept. And what they found was a physiological shift that mirrors a medical intervention. So simply by breathing these compounds, the subject saw that their adrenaline and noradrenaline dropped by 30%, which are two neurotransmitters that can contribute to stress. And they also observed a significant decrease in serum cortisol, and as well a massive boost in immune system activity that lasted for up to 7 days. So what does this tell us? Gardening also acts as a biochemical bath. It helps lower stress hormones such as the adrenaline and cortisol, and also stabilizes the nervous system.
So I wanted to discuss Shinrin Yoku, which is literally translates from Japanese to forest bathing in English. So forest bathing is just like a structured practice of going outside and immersing yourself in nature. It's really nothing that you're supposed to do in nature. You just kind of spend mindful or reflective time in nature. Some people journal, some people walk, some people sit. So there was a review study that was published in 2020 that was trying to find the minimum amount of time required to positively impact things like, mental health, physiological or psychological scores. So physiologically, they were measuring things that Afam mentioned: cortisol, adrenaline, sympathetic, other sympathetic like measures, blood pressure, heart rate. And then they would do some psychological scores as well. They took college age students for a few reasons. College age students oftentimes feel social isolation. They feel financial strain, pressure of stress of academic performance as well. This age range is generally the age range where a lot of mental health issues start to manifest. So if anybody would take a guess, how much time in nature do you think you need to spend to see something like significant physiologically, like a significant decrease in blood pressure, for example, or cortisol? How long? Yeah, like at once, like how many, like minutes, hours, or 5 minutes?
Yeah, she said 5 minutes a day, just so you know.
Anybody else?
An hour.
An hour? 20 to 30? Okay, 20 to 30 minutes. So actually, what they concluded from the study was in just 10 minutes a day, you can see a significant drop in cortisol, blood pressure, changes in these psychological scores that they did to test for stress and anxiety. So just 10 minutes, which is, if you think about back to the case, if Josh were to go to the garden each day, he could get benefit of being outside, just spending a few minutes there. It wouldn't be, he had to spend hours in the garden each day. So something that seems to be more like possibly sustainable in this case. So a lot of the data we've given thus far is based on surveys, cross-sectional data, interventional review analyses, but one could say that a lot of that is correlational, not necessarily causational. So in 2023, in Denver, Colorado, they published the first randomized controlled trial for community gardening intervention that's ever been done. And they took 490 participants, they split them in half. They put one group in a gardening intervention group and the other group in a non-gardening control group, which was basically people that signed up and got waitlisted for gardening. And then they wanted to measure things like diet, physical activity, and stress reduction. So what they found was in 2 out of the 3 time points, the people in the gardening intervention group were eating more fiber, which is what you get mostly from eating plants, fruits, and vegetables. Um, the gardening group spent more time in moderate to vigorous physical activity in 2 out of the 3 time points that they measured. And then as far as perceived stress and the GAD-7 measuring generalized anxiety, the gardening intervention group had greater reductions in scores, suggesting less stress, less anxiety, especially when they started out with higher levels of stress. So and like post-interview, like qualitative data that they found when they interviewed people after, trying to attribute, trying to get some reasoning behind these data, they found that growing and having available fresh food was convenient. One, they had more access to it. They felt a personal responsibility to the food that they grew. They had enhanced connection to the garden and the food that they grew in the garden. And they felt like they had feelings of accomplishment and purpose in their work. And then some even reported saving some money on fresh produce. So the next we're going to talk about social connection and relationships. So this is our 5th pillar, by the way. We're moving. So social connection. Gardening is really social and a collaborative practice. You're working with people alongside of you. You're exchanging ideas. You may be having conversations like asking people how did they grow a certain fruit or vegetable, what recipes were they using for it. But I just want to make it clear that community gardens are areas that are there's more than just gardening going on at community gardens. Okay, so gardens can have barbecues and cookouts and harvest festivals, movie screenings, and such. I wanted to highlight on the right side of the screen the Oakland Avenue Urban Farm in Detroit. What you're seeing in this image is a what they call a farm to table event, where volunteers at the garden they'll pick produce from the garden and bring it to a chef. And then the chef will prepare a meal and they'll set up tables and eat within the garden. And you can see, how nice the venue is, eating in the garden, and nice tables, having good like social interaction and communication. But on top of that, gardens can be a place for community organizing, education. On the left, you can see a youth farm in Brooklyn where it looks like a bunch of high school students are sitting around and taking notes. They're receiving education on things that could be gardening related or non-gardening related. But just wanted to reiterate the fact that collaborative efforts like community gardening are places to build social interaction and social interaction also amongst cultures and across generations. You have young and old, elderly people in attendance as well. So next, we're going to talk about the avoidance of risky substances. This is our last pillar. I have here pictured in the top left, her name is Catherine Sneed. She's the founder of the Garden Project in San Francisco. She's a lawyer. She founded this program as a program for incarcerated individuals to garden in the San Francisco County Jail. I wanted to include like a brief piece about her story because in the 80s, before she founded this program, she was diagnosed with end-stage kidney disease, and she went to the sheriff's office to propose that some of the local the people that were at the San Francisco County Jail, if they could go to an abandoned farm and actually just revive it. And they spent a few years out there taking the local people from the jail, the women specifically from the jail, and they were just reviving this garden. And over that 3 years, she went into remission of her chronic kidney disease, and she credits therapeutic gardening and working with the populations as a major contributor to her improvement in her remission. But we're talking about avoidance of risky substances, and so this study here, they took about 300, or they took out of the 300 people that were staying in those jails, they took 48 of them. They split them into two groups. One group was a gardening group. The other group was a non-gardening kind of therapy program. Most of these people that were participating in this study had drug-related charges. And so what they did was they compared these two groups, and what they found was within 3 months of them being released from jail, the people in the gardening group were more likely to seek help or seek assistance in some kind of way, to suggest gardening being just a place of collaboration, making that more feasible for them to do. The other thing we wanted to mention was that within those few months of being released, both groups, in the gardening group and in the non-gardening group, the non-gardening therapy program, the participants all had decreases in substance use afterwards. But it is noted that the gardening group had a greater decrease in substance use. So the other thing I wanted to talk about was not only risky substances, but also risky behavior. Some studies have shown a correlation between regreening a vacant lot, for example, into a garden or into a green space makes it less likely for crimes to occur in those areas. So this top study found that, with the exception of mobile vehicle thefts, crimes such as burglaries and robberies were decreased in these areas. The bottom study suggests that there was up to a 40% decrease in violent crime after a community came and regreened a vacant lot. This video.
Yeah, so we have a video showing, is it the largest farming or?
Yeah, it's the largest farm.
Yeah, in the Dallas community. Yeah, but I really enjoyed that video. One thing that was touched on, the guy in the end said, he's talking about rather than investing in things downstream, why don't we invest in things that really, can help the community? And one of those things, or one of the answer that we have to that is community gardens. Moving forward, we're going to kind of talk about how there's clear evidence for, community garden programs in prisons and their success. But first, we're going to start with, start with the problem. So systemic crisis. So to understand the solution, we have to look at the recidivism loop. Does anybody know what recidivism means? Revolving door. Yeah, revolving door. So, the likelihood of you returning back to prison, or, maybe getting caught up in a life of crime after you've already been there once, they look at within 3 to 5 years, like the percentage of people that happens to. So we have to look at that and address that. According to the Prison Policy Initiative, which this is an article from 2024, there are roughly 1.9 million individuals currently incarcerated. The Bureau of Justice Statistics shows a staggering 66% of them are rearrested within 3 years. So 66% recidivism rate. So why is this happening? Brand new 2026 research from UT San Antonio gives us a clue. So re-entry stress, that would be those who are being released from prison and re-entering back into society. Re-entry stress is 2.5 times more likely to cause reoffending than mental health. So obviously different things can contribute to that stress. Maybe you're worried about a job, worried about how you're going to interact with people from being institutionalized for so long. In addition as well, too, we spend about $80 billion annually on a system with these outcomes. So to keep it in short, you're basically putting $80 billion into something that has a 66% fail rate. So there obviously needs to be some change. Next would be the intervention. So So how do we pivot? First, we can look at horticultural therapy. Does anybody know what that is? I think it's up on the screen.
Yeah.
Should have hit it. Yeah, but using clinical practice to improve mental and physical health. And this can also help lower reentry stress that we discussed earlier on. Next is restorative justice. So allowing incarcerated individuals to provide fresh fruit to produce food, fresh produce to food insecure neighbors. So a lot of times when they talk about, going to jail, it's like repaying your debt to society. This is, I guess, is a better way to think about it. Like you're helping others while also doing something beneficial for yourself. And then last is vocational bridges. So transitioning from seeing those who are incarcerated as inmates, but seeing them, or I guess them seeing themselves as professionals. The middle picture is a Washington State facility, and Washington State colleges or Washington State University has partnered with those facilities and allows them to get what they call master gardener. Oh man, it's cut off. Master gardener credentials, and they can get this while in prison. And when they leave, they can get jobs, learn lifelong skills. So the evidence-based impact. So recidivism reduction was something, or recidivism rate was something we talked about at 66%. Participants in the nature-based program, like the Insight Garden program, show recidivism rates less than 10%. So that's a pretty significant decrease. In addition, when we look at mental health gains, structured gardening leads to a 4-point increase in life satisfaction and a 1.2 point increase in self-esteem. And these numbers come from the NIH, just a large database. And then lastly, institutional sustainability. So Washington State, which we talked about earlier, that's the middle picture. They have the Master Gardener program. Through their program, they diverted 1.6 million pounds of food waste via composting to grow 285,000 pounds of produce.
Mhm. So here I have various images from Rikers Island gardening program. So Rikers historically houses about 16,000 incarcerated individuals. Nowadays, I think it's not as much. They're holding like less than 6,000. But it is actually the home of the largest prison garden in the country. And the prison garden is about 2.5 to 3 acres in size, and it's referred to as the greenhouse. So the Horticultural Society of New York, they they're responsible for like maintaining this garden, the job training that goes on here. The greenhouse is able to produce about 40,000 pounds of produce each year. And then each year they take 85 to 100 incarcerated individuals through their program of training and educating them on gardening. So upon graduation, they would receive a certificate of completion and achievement, which makes them eligible to participate in the Horticultural Society of New York's post-release program, which is referred to as Green Team. And then at Green Team in the post-release program, they can continue to work and develop their skills as well as get connected with other job opportunities that are within the realm of their skills that they've developed in these programs. So these skills have allowed them to help cope with life and then to secure employment after release, which, looking at the data now on reconviction statistics, the black bar is the general population. The blue bar is the greenhouse, which is the prison gardening program. And then the green bar is the post-release program. So if those who went through both programs will be represented by the green bar. So within 1 year of release, you can see the general population has a 21.5% reconviction rate versus a 10% reconviction rate within the people who went through the programs. As well, if you look at within 3 years, the general population has about 47% reconviction rate compared to a 25% reconviction rate within the people that went through the programs as well. So just wanted to kind of give a schematic of a community gardening model and how this would insert itself into the community and everybody's role in that. So everything, of course, starts with the local residents. The local residents provide the labor for urban agriculture. They work in the community gardens and produce the food. And then you have some type of essential distributor like a farmer's market or a food cooperative where food is sold and exchanged. Seed can be given back to gardens or agricultural places. You've got people in the community who come to buy food. Restaurants can purchase food from central distributors as well. You create jobs for the community. You create job training for the youth and youth programs around this farmers market or food co-op. And then as well, other community programs like food and nutrition and cooking classes. And then often people who are involved within these systems go on to advocate for policy changes within the local governments to improve urban agriculture in those communities.
We
Yeah.
do have a question in the chat.
Oh, yes.
Is there any research on whether the benefits were more or less if people doing gardening, yard work, were listening to music or podcasts versus disconnecting and being present?
That's a very interesting question.
That is an interesting question.
We haven't seen specifics of if people had music in these studies or if they were just gardening on their own without any background noise. But it would be interesting to look at.
Yeah, I'm sure there's studies. I wonder if it'd be like a compounding effect versus just if you're just doing the gardening with no music versus gardening with like, I don't know. I know certain like waves of music have more of a calming effect on you. So yeah, that's a good question. But yeah, we didn't see anything.
Yeah.
So here we want to discuss La Fenica del Sur Community Garden. So this was started by 5 Latino women in the Bronx, New York, and they wanted to grow more culturally relevant food, similar to home. So I guess in this slide, while community gardening can be financially beneficial, we want to focus more on how it aids in financial resilience rather than just profit maximization. So in short, or I guess to reframe it, like we're not saying, oh, go into community gardening, you're going to be a millionaire. Rather, go into it because years down the line, this is something you're going to be doing and it's going to benefit your family and those around you. So we came up with how would I put it? Like a plan based off of the La Fenica del Sur Community Garden, if you wanted to get into it. So first, you have to have a purpose and a value. So La Fenica del Sur, it's a community-led nonprofit garden, prioritizes long-term stability over profit, like we discussed earlier, and it improves food access, health, community connection by turning unused land into a shared neighborhood asset. So how would it operate? You'd have, in their case, it was 5 Latino women, but you have a small community leadership board, as well as volunteers. And the volunteers, would come when they could, but the community leadership board or team would be the ones who are monitoring it day in and day out, kind of just passing through and making sure everything's running accordingly, as well as focusing on high yield crops, education, and keeping an engagement to keep costs low and participation high. And I guess the most important question would be, how would all this be funded? So vacant lots or any area of land is owned by a state. States obviously have different laws when it comes to that. Some of them, if you go talk to them, which you would have to, they may just give it to you for free, or it may have a price tag on it. So how would you pay for that? A diversified funding mix. So you could look at grants, just kind support from community donations, and small sponsorships for flexibility. And then any income that you receive from any surplus of produce that you produce, like let's say you're growing cabbage. Obviously, you're feeding your family, yourself, and the community, but you have excess amount and go to a farmer's market and sell that. You could then put that profit back into the community garden. And why is this sustainable? So stays resilient by keeping expenses low, avoiding dependence on one income source. And finally, you're not measuring success based off how much money you're pocketing, but rather food grown and people served. And then any money you pocket would just be extra. So here we have different these opportunities within the Springfield area. In the bottom middle, I guess the laser would have been helpful now. You have the UIS Community Garden. So they have one on their campus. And then Jefferson Park Community Garden on the bottom right. That's an ad they had. They had plots where people could pay, I think it's like $15 and grow whatever they wanted to and just monitor it throughout the season.
And you could do similarly at Eno's Garden here in the top right, and then at Motherland Garden. We have Eve pictured here. He couldn't make it here in person today, but we've been coordinating to work on like a gardening workshop for anybody in the community or anybody who would be interested in it. Also, just wanted to plug a couple of things. The American College of Lifestyle Medicine here is what a lot of this presentation was based off of. And as it was mentioned in the introduction, I co-founded this organization with my classmate Savannah. I see her in here today. And then as well, we didn't talk too much about the environment as it relates to community gardening and regreening of spaces, but we have a podcast. It's called the So Ill Podcast. Some of the students are co-hosts on it, and we talk about various topics: plastics, climate change, etc. That's available anywhere you can listen to podcasts.
Yeah, and here again is just a fleshed out opportunities within Springfield, Illinois, with the addresses and what they do.
Yeah. And then, yeah, lastly, like as I mentioned with the food growing workshop that we'd be collaborating with Eve on, if anybody was interested in that, we'll leave this up. You can scan the QR code. And if you just fill out the information, like we'll send you more information. We're looking at April or like second or fourth week in April to kind of coordinate this. But yeah.
Yeah, so this is all we have. We want to thank Don and the Office of Correctional Medicine for letting us come and present to you guys. Hopefully you all took something away from it. I think it's what, like 1:03. We don't have any time for questions, do we? Yeah, I did anyone?
We don't have any further questions in the chat.
Question?
Yeah.
A question. So you talk about the gardening. So what is since we live in a space where there's winter, so you can't really garden in the winter. So have you seen any research about that as opposed to where places they can garden all year long, as opposed to like somewhere where they have
Some things people try to do is build greenhouses.
Yeah, first thing I was going to say.
They build greenhouses, more climate control. You can keep you could kind of keep the temperature a little bit warmer. Yeah, a little bit warmer inside of the greenhouses. So you can grow certain things within the greenhouse to the extent, I mean, it'll be limited by the size of the greenhouse and how, insulated it is or however the case may be. But that's one of the things that people can do. Some things can grow indoors.
Yeah, I was going to say another thing too. I know some crops are more resistant to like cold weather.
Yeah.
Like I can't remember if it's kale or broccoli, but I know one of those people start planting them in like the colder months. So that's something else, too. But I'm sure a place that has, better weather year round versus you just have to become more creative. And the product yield would probably be more in the places that have better weather. Yeah.
Well done. In the chat just said, great presentation, guys. This was very insightful.
Thank you.
So thank you to Justin and Afam for joining us today and presenting on therapeutic gardening on behalf of the Office of Correctional Medicine and their Grand Rounds. And we hope to see you all at future Office of Correctional Medicine events. Thank you.